So this is one of our exercises that we use very often in the office because patients they tend not to know where their head is in space, okay? There's a couple different things that we can test for it. One of my favorite ones to do that is just kind of an eye-opener for the patient as well, because I already have seen it, is one, we turn on our laser, okay? And what we do is we have you stare at your laser, turn your head to the side as far as you can, and then bring it back and put it back in the middle of the laser, or in the middle of that target. Then we do it again, and then we come back and put it in the middle of the target. Then we have you do it with your eyes closed. So you close your eyes, you bring it to the right, bring it back to the middle, and then you open it up. And you see I'm still within kind of like this circle. The majority of patients, when they do it, they turn their head to the right, they bring it back, and they're like, hey, open your eyes. Whoa! And you're way off. So again, if the brain doesn't know where the head is in space, it's going to have a very tough time understanding what's going on around them, where they're moving, is the world moving. It's this big discommunication. So we like to use this one a lot. So we use this therapy to help kind of recalibrate where the eyes think they are, where the neck thinks it is, where the inner ear thinks it is, okay? So one of our first exercises that we do is, again, we turn that laser on, and we just follow that laser in that line. So we're just going to go from here to this target, and sometimes we'll just stop back in the middle, and you come back, or we'll go all the way to the left, and then back, okay? What we want to see is it to be nice and smooth. We don't want to be jerking all around. And again, sometimes it might be difficult at the beginning. You might be jerking, but that's because the brain doesn't understand it. But the goal is to be smooth. We also don't want to be going like lackadaisical, just going, hey, yeah, la, la, la. Like moving quickly, moving it fast. We ask people how they feel afterwards. They're like, well, I feel dizzy. And I'm like, well, of course you feel dizzy. Your head was moving all over the place. So on this one, we're really trying to be smooth and coordinated into these targets. Sometimes we'll have you watch the laser as we do it. Other times we might have you keep your eye on the red target, and through your peripheral vision, stop the laser in those targets. Okay, we might go up and down with it. We might go into the figure eights as we're going around and getting bigger and smaller. But again, the goal is to be nice and coordinated. We don't need big, fast movements. Bigger and faster does not work. It does not make us better, okay? And we want to really work on being smooth. We don't want to have a lot of this going on, or if we shoot past the target and come back, that doesn't help us. So again, nice and smooth movement.